allopathic medicine and specialists outside of diabetes and cardiovascular disease, they'll get handed a sheet of paper that says, go do this, rather than fundamental foundational education on what is specific for that patient. Even though it feels as if that big ship is turning a little bit, it's not turning quick enough for the care that we need.
I just had a patient this morning that came to me with 18 different supplements. She's on social media seeing a bunch of TikTok and Instagram ads and thought, oh, I need this. This could help. But it turns out she didn't really need most of them.
As I was going through this program, the big thing that I've been thinking the whole way through was this is how it should have been from the beginning. I've had to piece this together for myself once I graduated, and you have created a program that handholds you through the whole thing in a very logical sequence, like layering in the order that you need to learn the things in order to have a really applicable grasp of the information.
So much of the industry is education by the supplement companies or by the testing laboratories, and therefore people bounce around thinking they've got the new thing because that's the latest seminar we've done. There's value in doing those courses, but bringing it together requires that higher level thinking where you're connecting the dots.
For a while, I went down rabbit holes trying to figure out nutrition and diet and lifestyle for myself with trial and error and tons of money down the drain with a supplement graveyard in my cabinet. But education programs like this is so helpful because there's so many gaps when it comes to medicine.
There is so much noise out there. And if you're getting your information from podcasts or social media, the vast majority, there is significant bias because people have something that they're selling. To cut through the noise and to get genuinely evidence-based information, I just think it's essential.
Are you looking to have that really deep base of knowledge so that your brain and your clinical management are able to help anybody who walks in the door? Or are you looking for a cookie cutter experience? Here's your cookbook. Here's what you do for X, Y, and Z condition. I think it exists everywhere, even on AI. The AFNLM program is a great jump in for folks that have a clinical background that didn't come with a robust nutrition education. I also think it is a great jump off for a layperson that knows a lot about health but wants to learn more of the specifics.
If you're considering functional nutrition or feeling like you are missing something in clinical practice, or just average individual who wants to learn more about nutrition, just go for it. There's so much you can take from this course and this certification that you won't know until you get in, and you will be addicted.